Adenocarcinoma of colon. Clinical presentations. So colon cancers can be two type, right-sided or left-sided. See, right-sided means cecum, ascending colon, and the proximal part of transverse colon will be involved. Right-sided will affect the cecum, ascending colon, and the proximal part of transverse colon. Left-sided colon cancer will involve the distal transverse colon, then descending colon and sigmoid colon and rectum. Right-sided will involve the cecum, ascending colon, proximal part of transverse colon. Left-sided will involve the distal part of transverse colon, descending colon, sigmoid colon and rectum. So this is on the basis of location. Okay, on the basis of location, the right sided will involve cecum, ascending colon and proximal transverse colon. Left sided will involve the distal transverse colon, descending colon and sigmoid colon and rectum. Clinical presentations. Right sided colon cancer, it has the clinical presentation is late. The right-sided colon cancer presents late due to large lumen and liquid stool. It presents late due to large lumen and liquid stool. The symptom is iron deficiency anemia, जिसके कारण फटीग और वीकनेस होगा. ठीक है. सो राइट साइडेड कोलोन कैंसर का प्रेजेंटेशन लेट होता है. द सिम्टम इज आयरन डिफिशियंसी अनीमिया, जिसके कारण फटीग और वेट लॉस होगा. इट इज़ एसोसिएटेड विथ एक्सोफाइटिक ग्रोथ. ठीक है, एक्सोफाइटिक ग्रोथ मतलब पॉलीपॉइड मासेस दैट ग्रो आउटवर्ड्स. एक्सोफाइटिक ग्रोथ होता है आरसीसी का. एलसीसी लेफ्ट साइडेड कोलोन कैंसर विल अपीयर अर्ली. ठीक है, इसका प्रेजेंटेशन अर्ली होगा क्योंकि छोटा लूमेन होता है एंड इट हैज़ सॉलिड स्टूल. ठीक है, आरसीसी का प्रेजेंटेशन लेट होता है, एलसीसी का प्रेजेंटेशन अर्ली होता है. सिम्टम्स इंक्लूड occult bleeding, changes in the bowel habits and cramping. ठीक है, तो symptoms में there will be altered bowel habits, then cramping and occult bleeding. Occult bleeding, changes in the bowel cramping, occult habits, changes in the bowel habits and cramping, and it is associated with apple core lesion. ठीक है, उसमें एक्सोफाइटिक लीशन था, इसमें एप्पल कोर लीशन होता है ड्यू टू सर्कमफेरेंशियल ग्रोथ कॉजिंग द लूमिनल नारोइंग. ठीक है, तो इसमें एप्पल कोर ग्रोथ के कारण लूमिनल नारोइंग होता है. सो क्योंकि आरसीसी का प्रेजेंटेशन लेट था, सो इट हैज़ वर्स प्रोग्नोसिस. इट हैज़ वर्स प्रोग्नोसिस ड्यू टू लेट प्रेजेंटेशन and resistant to chemotherapy. Left-sided colon cancer has better prognosis because of early detection and better response to chemotherapy. Left-sided का presentation early होता है, apple core growth होता है, better prognosis होता है because ये early detect हो जाता है and it is sensitive to chemotherapy. Then genetic alterations in case of right-sided colon cancer, most likely to have microsatellite instability and defective DNA mismatch repair. So right-sided colon cancer is more likely to have microsatellite instability and defective DNA mismatch repair. Okay. Right-sided colon cancer is most likely to have microsatellite instability and DNA mismatch repair deficiency. It is more likely to be associated with BRAF mutation. It is most likely to be associated with BRAF mutation. RCC is more likely to be associated with BRAF mutation. Then LCC. LCC more likely to have chromosomal instability. LCC is more likely to have chromosomal instability. It is more likely to have chromosomal instability associated with KRAS and APC mutation. It is associated with APC mutation and KRAS mutation. Left-sided is associated with APC and KRAS mutation. Left-sided is associated with APC and KRAS mutation. The LCC is more likely to be associated with sporadic adenocarcinoma sequence. LCC is more common in sporadic adenocarcinoma sequence. So right-sided colon cancer, it has a raised area, that is exophytic growth. Right-sided has exophytic growth. Then it has manifestation as iron deficiency anemia, and it has a late presentation. Late presentation or resistant to chemotherapy के कारण it has worse prognosis, and it is associated with microsatellite instability, DNA mismatch repair deficiency. Microsatellite instability and DNA mismatch repair defect. Okay, it is associated with BRAF mutation. Okay, LCC is associated with chromosomal instability. It is associated with the sporadic adenoma carcinoma sequence, and with APC mutation and KRAS mutation. So L-sided, where there is lumen narrowing, there is occult bleeding, changes in the bowel habits and cramping. Okay, there is changes in bowel habit, there can be diarrhea, and it has apple core lesion. Right-sided colon cancer किस चीज़ को इन्वॉल्व करेगा? Cecum, ascending colon, and the proximal part of transverse colon. Left-sided will involve the distal part of transverse colon, descending colon, sigmoid colon, and rectum. क्लिनिकल प्रेजेंटेशन आरसीसी का लेट होता है, आयरन डिफिशियंसी अनीमिया के कारण, फटीग वीकनेस होगा, एंड एक्सोफाइटिक ग्रोथ होता है इसमें. ठीक है. LCC का प्रेजेंटेशन अर्ली होगा, देयर विल बी ऑल्टर्ड बावल हैबिट्स, क्रैम्पिंग एंड ऑकल्ट ब्लीडिंग. इसमें एपर कोर लीशन होता है, इसमें एक्सोफाइटिक लीशन होता है, इसमें एप्पल कोर लीशन होता है. राइट साइडेड का प्रेजेंटेशन लेट होता है, इट हैज़ वर्स प्रोग्नोसिस. लेफ्ट साइडेड का प्रेजेंटेशन अर्ली होता है, इट हैज़ बेटर प्रोग्नोसिस. देन जेनेटिक ऑल्टरेशंस में RCC is more likely to have microsatellite instability and DNA mismatch repair defect. Okay. RCC has microsatellite instability and defective DNA mismatch repair defect. And left-sided colon cancer is most likely to be associated with the sporadic adenoma carcinoma sequence. It is more likely to have chromosomal instability and mutation in APC and KRAS.